Hi, Dr. Peter Montgomery, family practice doctor, here to give you another COVID update. Today's issue is we're at the peak nationally and possibly for the world. We're just past the peak. So, how long do we need to keep up this quarantine? That is the difficult question to answer. Stop it too soon, we can risk a second wave. Keep it going too long, there are huge economic and personal trouble if we keep it going for longer than necessary. So finding that balance, that's the hard part. So I'm going to give an update for today, see where we're at, and that helps put things in perspective to understanding how long do we need to keep up doing our best to try and social distance, washing, waving, wiping, and not touching our face. How long do we got to keep this up? And I'll help you answer that question in just a little bit. So I like to start off with looking at the Kinza weather map, giving a temperature weather map. They've added a few more variations in the temperature to make the observed temperature map a lot more useful. Before it was like, oh, everything was nice and low, but they've added a few gradations, and I appreciate that. We can still see the East Coast, New York, New Jersey, Connecticut hot spot there. It also allows us to pick up that I don't know if this is new, but because of the new view, it appears like there's still a new hotspot, southern Indiana, southern Illinois, Kentucky, Tennessee, going down here. Florida is still relatively hot, as well as the East Coast and the lower half here, South Carolina, Georgia, North Carolina, South Carolina, Georgia area. A little bit warm out here. I'm not sure what it means, but Florida coast there. California still cool. Texas very cool. The trend again kind of warming up here in this Tennessee area, Indiana area, and again South Carolina. Actually heading cooler. Finally off of steady to cooler here in the hotspot in New York and Texas. Florida's been steading down, steady, not really lower than average yet. Then we get to the atypical, which actually gives us a better idea what's higher than the traditional temperature for the past 10 years that they've been studying that. The U.S., again, we're doing a very good job. The number of people reporting a fever, I mean, we're well below 1% of people complaining of fevers down here. This is about as healthy as we've been as a nation infection-wise. How low does this number go? In Missouri, we're actually at 0. So observe 0.32% of the population has a fever right now. So we're doing a very good of trying to do it. People, if you are running a fever, you're in the minority. If you're running a fever now, something's going on, and you should be seeking medical help, contacting your doctor, or going to an emergency room. That's how atypical a fever would be at this point. So I think we're all doing a very good job. Looking at the world, and get the world number here because I was practicing ahead of time here. The confirmed numbers are, a trend we can follow, but mostly meaningless because the testing has not been that great, and some countries aren't testing very well at all. The total deaths is a solid number that is trackable. But if we look at worldwide numbers, the peak happened already, February 3rd for the world for what's being recorded, pretty flat since then. So if you look at the logarithmic, that steady line has started to curve. So we've been waiting for that to happen in the world. Some very large countries are starting to get it. This whole area from India, Bangladesh, and Southeast Asia is going to get it. Africa starting to take off, and Brazil and South America. And Russia really started picking up just a week or so ago. U.S. numbers looks like, again, we peaked here, dropped, tried to come back up, and yes, it is a higher number, but I think that's still overall a pattern of peaking. And if you look at logarithmic scale, we're no longer a straight line, which is logarithmic growth, and it's curving as it has been for a while. Spain and Italy, France, they've all had a chance to, nearly flatten out there. Steadily going down. Germany is ahead of the curve. United Kingdom, not quite. They're still Still, if you look at the number of cases, they're still actually had their highest day on the 9th. And we don't have days numbers in here for the 11th yet. And of course, nearby Belgium is flattened out. Netherlands right next to that also flattened out. So it is coming, curve shifting should be coming to the United Kingdom soon. Russia, the numbers are still going pretty straight up on the logarithmic scale. It's still a pretty straight line, a hint of a curve. Hard to say. You really got to give it 3 or 4 days to really see the change. So, seems to be the pattern that we got here for the world. Testing for the U.S. We've been testing at over 100,000 a day and still keeping up at that. So good that we're keeping up with that. Here's the numbers for the world, and the numbers, the best way to look at it is the solid numbers, not based on testing. That is deaths. Yes, there is misreporting on the deaths. People are dying at home. They're not being counted because they weren't tested. And sadly, that may be a lot. That may be some revision upward of the actual death toll as they learn how to count that and bring that into the numbers. But you can also see the countries that got hit the worst. And the pattern, Sweden is an outlier. In the Nordic countries, they did not do any social distancing or shutting down their country at all. They stand way out there compared to Norway and Finland. Matter of fact, we got to bring the numbers way down here to get down to Finland. The next door neighbor is at 9 deaths per million. And Sweden is pushing 90. Nearly 10 times as many people died compared to their neighbor, based on just different practices by their government and possibly different practices by the people. The Finland are very into taking a sauna every day, and is that protective, or at least helps you fight a virus off better, to run basically a fake fever once a day to boost your immune system. I am a big fan of that. Here's St. Charles County, just our county in our nice, clean description of what we should do to help prevent and keep things under control. Watch out for vulnerable populations, people older than 60, people with serious chronic medical conditions should take extra care. People at low risk should self-monitor. People at medium risk advise voluntary quarantine. High risk seek help at the first sign of any fever or shortness of breath, any of the symptoms. United States, we do have a tracking device. Thanks for the University of Washington for making this, showing utilization, and we are right there at peak utilization right now of hospital beds over the next few days. This weekend into Monday is kind of peak utilization for, we got clicked here to ICU beds, which is kind of the critical number, also hospital beds. They do track how many hospital beds, ICU beds, and ventilators are in the U.S. This number a few days ago over here in bed shortage was 36,000. We've done a good job of bringing new beds online as they're making temporary places. The ICU beds also drastically dropped over the past few days. Better utilization and better use of them, and the ventilators. The projected death rate, it's quite a wide variety here, but the pattern looks like we may be at peak and heading down to people dying. It does say here peak in 1 day. The number of projected people dying is holding steady at 60 for now as far as projections. And here's where we actually are at right now. So this gives us an idea of asking the big question: how long do we need to keep the quarantine going? There's still going to be people having, in the hospitals way above normal out to June. ICU beds, still going to have utilization June 1st as bad as we had it at early March when we were going, what? Breaking it down by states, not every state is really quite at the peak due to different travel patterns and stuff. I am in Missouri, so I vote us to be the middle of the country-ish enough. We're not going to hit our peak until April 26th on ICU bed use. That's still 2 weeks to come for us to hit our peak um, there. And of course, with that goes the peak of people dying. So that our peak is still out there for 2 weeks here, with still a ridiculously high death rate per day here on June 1st, from this. So, and hospitalization use. So, well through May that we need to keep this down. Otherwise, we could, with that many people still infected, numbers could be going up. Again, another guide is how many people have been infected already. The city of Bonn, Germany, they do have access to the antibody test that can see who has already been infected. And they took 1,000 random people off the street, just a sampling, and did a quick test on them. And 15% have already had it. And most of them, their reaction was, what? They didn't know, even though they had been sick. So 15%. Again, perspective, your average flu season, about 10% get infected. So the flu, we're very used to the flu and the flu numbers. So 10% of the U.S. population gets infected with the flu each year. That's with the vaccine. And some people, if it's the same strain as year before, or if it hadn't changed that much, we've seen it before. And we also know how to deal with it. And it's less contagious than the coronavirus and less lethal than the coronavirus. So this is more contagious, more lethal, and nobody had any immunity going in. And no vaccine exists. So preventing the second wave, and the Spanish flu of 1918 had 3 waves. There was a wave in the end January to March in 1919 that was bigger than the first wave still, and the second wave was huge. And it happened in September. Every year I deal with a thing that I've just called the back to school bug. Everybody was spreading germs all summer, and then they all get back to school, and some kid goes to school with a fever because mom's had enough of little Jimmy, and he goes there, and every classroom's got a little Jimmy, and every classroom that germ gets around, gets the other kids, gets the parents, gets the teachers, gets spread around. So usually by September, I'm seeing the back to school bug. As I've been known to call it. I'm usually viral and watching for the streps in there, especially in the kids, and checking all that. And it kind of goes through waves and kind of builds and then calms down. But it's still happening when Halloween happens. And then we go to all these Halloween parties and other fall festival-y things start happening in large social gatherings. And then we get another build up for that. And just by the time that wave calms down, we have Thanksgiving. And then we spread our germs from different cities again, and then the flu season's on. Then by then now the flu is mixing in with the back to school bug, and it's on. So I'm really afraid of that wave throwing COVID in the mix. The more people, how many people will be immune that will have helped. But is it 15%, 20% by then, 30% by then? At about 60 to 70% immunity, that's kind of ends a lot of diseases if we can get enough people immune. No fresh meat for the virus to latch on to, and so we need to get there. That's going to probably need a vaccine protocol to do that. Get the vaccine out hopefully next spring, preferably before the summer. Get everybody vaccinated, so that by next fall, we'll have everybody vaccinated. These are a lot of hopes and dreams still at this point, because not a lot of things have come to fruition in time that we've wanted them to. The ventilators are being made a little bit late. The tests were made and not accurate. And this has made my job as a doctor very frustrated. My wife goes, "You're a lot more angry now." I'm like, I'm really trying not to show it, but yes, I am not getting the tests I want to have to test my patients. I don't have a proven treatment protocol. I'm giving people good viral advice and good hand washing advice. I wish I had an antibiotic I could use. I'm still a big fan of the hydrochloroquine and Zithromax combination, but I had no hard data to go on, no double-blinded placebo control, and a lot of medicine. We don't have what we call level A medicine for very serious conditions. We have a lot of serious conditions we treat with level C evidence, expert guidance. Well, we do have expert guidance and good tests that these medicines are helpful. And that's what we got right now. So we're going to use what we have right now while we keep working for better. So this wave is going to calm down the quarantine. Sometime in May, they're probably going to say, okay, let's segment, decrease the quarantine. Some other countries are going to do it first. And we'll have the advantage of watching them and getting a heads up whether it's too soon or not. So, Wuhan, broke their quarantine, but they held it for a good 90 days. That was a very long time. So, we're nowhere near that. We're not even at 1 month. We're not even at 30 days yet. So how long are we going to keep, the national self-quarantining, forced quarantining, hand washing, waving, wiping, and whoa, don't touch your face going on? 90 days is what seems to be the word that I'm hearing, so we need to keep up with this. It is working. We have flattened the curve dramatically. The estimates early on were 500,000 Americans dead, and we're keeping it to 60,000. So that's nearly 1/10 of what would happen if we did nothing. I think we've done a very good job. And if we didn't have the modern medicine we have, that number would be several million. Everybody in the ICU that was saved been here because in 1918 they didn't have ICUs. They didn't even have oxygen or IV fluids. Those things didn't exist that have been helping so many people. So I think we're coming along. Let's stick with this. We'll play it by ear, and everybody keep doing everything we can, washing and waving and wiping, and whoa, don't touch your face, social distancing, and self-quarantining and forced quarantining when it's necessary. So hang in there, and I'll give another date in a couple days. Thanks.